Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then what is Moorens ulcers? Moorens ulcers is a peripheral ulcerative keratitis which is mainly caused by ischemic necrosis. So Moorens ulcers is a peripheral ulcerative keratitis caused by ischemic necrosis. Why is this ischemic necrosis occurs? It is because of the vasculitis. Okay, actually, first and foremost, there is vasculitis of the limbic vessels will occur. First, there is vasculitis of limbic vessels. This vasculitis will actually release the enzyme collagenases and proteoglycanases are produced. Where are they produced? They are produced from adjacent conjunctiva. Adjacent conjunctiva will release the enzymes collagenases and proteoglycanases. These enzymes will result in peripheral necrosis, resulting in peripheral ulcerative keratitis. So this Moorens ulcers is of two types. One, we have limited form of Moorens ulcers. And second, we have progressive form of the Moorens ulcers. Now this limited form of Moorens ulcers is this limited form of Moorens ulcers is unilateral and it is most commonly seen in elderly patients, whereas this progressive form of Moorens ulcers is usually bilateral and it mainly is seen in young individuals. So these are the two different types of Moorens ulcers.
thank you and thank you for watching.